Well, hello everyone and welcome to Kids Clinic, helping families affected by substance use disorder. Today's session is being recorded and will be archived on the Healthy Connections website. And for those of you that cannot attend today's live session, I am Crystal Welch with Quality Insights, one of the presenters for the webinar. And before we begin, please be advised that during today's presentation, we will have opportunities for questions and comments. And let me advance the slides here. There we go. We will have a time for questions and comments. And since most of you all are listening today through your computer speakers, when the opportunity does arise, just use the chat or the Q&A feature on the right-hand side of your WebEx player, and we will address any of your questions as they arise. And, we will have plenty of time at the end of the presentation to do so. As a reminder, all of the lines for today's webinar are on mute. So even if you called on the teleconference number, please just use the Q&A or the chat for feedback and your questions. So for today, we will provide an overall introduction to the Knowledge and Developmental Steps, or KIDS, K-I-D-S, Kids Clinic. And today's presenters are Dr. Mitzi Payne. She is with Marshall Neuroscience, and Mariano Lin, with Marshall University, and also Pam Holland. And there we are. I'm sorry. And then I am your host, Crystal Welch, and I'm with Healthy Connections. I am part of the Media Marketing Work Group, one of the co-chairs for that. I work on the steering committee as the recording and corresponding secretary for Healthy Connections, and I am the lead project coordinator for Quality Insights. So what is Healthy Connections? Just as a little overview for some of you all that might not be as familiar, we help pregnant women and mothers and their families and help navigate them through treatment and support. We love to receive referrals from our community partners, and we have family navigators. We have 3 family navigators that work with a caseload. It says a small caseload, but they are in the 40s, I do believe, for their caseload. So I guess it depends on what the definition of a small is. But they have a plan for each client and child that they work with and provide assessments, and they have a lot of one-on-one time with their clients, and then they also have a credentialed peer recovery coach that also works with them. You can see many of the coalition members here. This is not an exhaustive list, but just several of them, so we are very proud to have so many coalition members be active and participating in Healthy Connections. I mentioned I'm with Quality Insights. Just a little bit about us. We're one of the largest nonprofit organizations in the country, and we focus a lot on data and working on solutions in the community to achieve goals of better care, smarter spending, and of course, healthier people. We have over 300 employees, and we really do a lot of consulting on diverse things with healthcare, CQI, or continuous quality improvement. We abstract with medical records, with VA contracts, do a lot of data analysis, and one of our specialties is communications, and that's one of the ways that we're really helping out with Quality Insights. With Healthy Connections. So what we do for Quality Insights and Healthy Connections, we're really working to brand Healthy Connections, and we have a wonderful web infrastructure that we've done with our website for Healthy Connections. We love to do a lot of partner coordination, and we're also going to be coming up with a large campaign starting in September where you're going to see more and more about Healthy Connections as we have billboards and radio spots, and one of the things we do, like I mentioned, among advertising is our webinar production. So this is our second installment of our webinar series, so we're really happy that you were able to join us today. Dr. Mitzi Payne, she's up next, and Dr. Payne has recorded her session. It's a very exciting opportunity that she's had. She is actually out of the country, and she was able to do a little presentation actually on her work with the Kids Clinic. But Dr. Payne is the founder and medical director of the Kids Clinic. She's a professor at the Joan C. Edwards School of Medicine. She specializes in neurology and specifically pediatric neurology. And of course, she has many passions with pediatrics and a clinical interest in developmental delay, seizure disorder, concussion, cerebral palsy. So without further ado, we are just going to pipe in a message from Dr. Mitzi Payne.
Hello, this is Missy Payne. I'm a pediatric neurologist at Marshall University. I am the founder and medical director of the Kids Clinic, which is a multidisciplinary clinic aimed at providing services that support and enrich families that are taking care of children that may be in some way affected by drug addiction. We started this clinic several years ago, me and some of my best colleagues, because we realized that there were many children out there falling through the cracks and not getting the needs that they needed. We also realized that children, either born with exposure to opiates or living in environments where there might be drug abuse, undergo unique challenges and therefore have unique needs. We have found some ways to help these children and are trying to develop more curriculum as well as doing some research to find out what works and what doesn't. Our clinic is multidisciplinary in the fact that we try to encompass all areas of neurodevelopment and child welfare for that child that we happen to be seeing in the clinic. We may not all be present at the same time every visit, but we're all still a team and share ideas and definitely converse about the patient with coming up with an appropriate plan for them and their families. I am very lucky to have a psychologist, Dr. Lin, a speech therapist, Pam Holland, a physical therapist who is also a liaison with Bertha Free, Stacy Clem, a physical therapist through Marshall, Gretchen Foes, and representatives from our home visiting program, notably right from the start. Our team will likely continue to expand as we also have kind of more on the sidelines Dr. Pitzenbarger, who is a general pediatrician and actually takes care of many of these infants while they are still in the hospital after birth and during withdrawals or needing observation before going home. We have a very good team that works together, but our main strength, I feel, is that we all have the same goal, envisioning a healthier life for these families, because we know that children don't live in bubbles, and we can't help the child unless we help the family. And sometimes families can be resistant to help or may have their own struggles that they're going with. So as part of Healthy Connections, we have some extra workforce to help us, whether it be transportation, social services, having certain family members in addiction counseling or rehabilitative work programs, you name it. So we're really blessed to be in a unique situation where we can all work together for the child as well as have the community support to help the family. Our clinic is definitely not exclusive to anyone. We will take children age 0 to 18. We will also see siblings of a child that might be of concern. And we definitely want to be open to families, as many family members to be able to visit and partake in the visit as possible. We don't even necessarily have to have a known drug, so to speak, exposure with that child, but even just children that are high risk, we know will be at high risk in the future of possible their own drug addiction. So we really do enjoy taking all comers and all families.
Well, we certainly appreciate Dr. Payne's message to us and her taking the time to be able to join us by recording in her very busy schedule, and as she is in Europe at this point. So we're going to go ahead and transition to Dr. Mariano Lin. We are so glad to have Mariana join us today. A little bit about Dr. Lin. She is a proud graduate of Marshall University, where she received her bachelor's and her master's, and she received her PhD at UNC North Carolina in Chapel Hill. She is the chair of the Department of Psychology at Marshall University, and her day-to-day responsibilities, she has a lot of operations of the department and a lot of supervisory from anywhere from her office staff to graduate students, and often is able to oversee different programs and her day-to-day scheduling classes and just the budgetary things that she works with as well. And in her spare time, she works as a professor, so she is always on the go. I know she is definitely one to contribute to her community, of whether that's working with the homeless, and she has a heart with the community as a whole. So at this point, Mariana, I'm going to pass the ball to you, and you are free to present.
Okay. Thank you so much, Crystal. I appreciate it. I'm really, really pleased to be here today and be able to share some information with all of you about the Kids Clinic. This has been a wonderful project that was started by Dr. Payne, and working with her and with my colleague Pam Holland and all of the other wonderful professionals. We are just really, really excited to also have the privilege of working with these kids and their families, who are some of the most amazing people. So in terms of getting started with kind of sharing a little bit about how the clinic works. Sorry, I'm having a little bit of technical difficulty, but we'll get it. One of the things I always like to remind us is that a child's world is a really busy world. There's lots and lots of pieces in it, even when they're very, very tiny. And so there's all kinds of things that impact their development. And so when we see kids either that have, certain exposures or that have various things going on, one of the things that we always like to keep in mind is there's an awful lot of resources at our disposal. They have some wonderfully supportive families, sometimes they're foster families, different kinds of families, and community supports. And one thing we like to do in the Kids Clinic is make sure that we're aware of all of those wonderful supports and able to make sure that the families are connected to those so that they and their children can continue to develop in the healthiest way possible. And so really what our clinic is providing is sort of what we like to think of as a psychosocial developmental checkup. Very, very similar to what we do when we take kids to the pediatrician for their shots, and just to see if everything is on track. And so when families come to us, when they trust us with their precious little ones, what we're all trying to do is get a sense of, well, where are we developmentally? Where do we want to be? what are some things we need to put in place for these kids and families so that they can continue to grow and develop and to move in the direction that they want to move. So we really want to be that kind of resource for kids and families in a variety of different situations at a variety of ages. And so for families that come to the kids clinic, depending on the age of the child and the needs and some of the things that may have already been done and already in place, we wanted to kind of give you a picture of what you could expect, what kinds of things we might be doing, who you might be interacting with, and sort of how the process will go. So when you come to Kids Clinic, you will be working with a team of us. We've been working together for quite some time. So as Dr. Payne was sharing, it could include her, myself, Dr. Holland. It could include also a number of other professionals. And everyone is focused on the same set of goals, which is to provide the best picture of this child's current level of development and to be able to work with the family to chart the direction and the goals that they have for that child's development from there. So we see children as young as newborns that have just sort of come into the world. So for children that are at that age, those first 3 years of life, you can expect us to probably do something involving a developmental screener like the Battelle that tells us a little bit about where they are in terms of sort of interacting with the world and problem solving and processing information, and it'll give us a sense of whether there are areas that are in need of some extra attention, what's on track, what kinds of things we can be anticipating, and what kinds of strengths we can build on. We also will offer the parents the opportunity to take something called a Parenting Stress Index, because as parents we all know that raising children is a wonderful experience, which occasionally brings a little stress with it. And when we have concerns about our children or worries, sometimes that can bring some additional stress. And so we want to know what are the areas of concern that we can help parents find some additional support for. So the Parenting Stress Index would help us identify those areas. We also have something called a PHQ-2 that just sort of helps us to identify people in the family who may need some additional support, whether that's just having the opportunity to talk about concerns that they have for themselves and for their kids, or whether they need something a little bit more long-term and a little bit more involved, which could involve counseling on a regular basis or consultation with someone in behavioral health, just to help make sure that they are able to respond to their own needs and the needs of their family in the healthiest way possible. So we screen for those behavioral health needs as well, because we believe that we want to provide support and assistance for the entire family system, because that's when everybody functions better, is when the whole system is supported. Finally, there's a birth to 3 checklist of learning and language behavior. And I know that Pam Holland, who is our expert in communication disorders and speech and language development, is going to be sharing more information about that, I'm sure. So even for our littlest folks that come to see us, we try to use these particular tools to give us a good, clear, cohesive picture of the development of the individual child, but also how that development is proceeding within that family system. And we try to identify with the team, and the family is an integral part of that team. We try to identify where are the areas where we need to provide additional support, what are the strengths that we can build on, and then we want to build that connection and that relationship so that we continue to be of service to that family throughout that child's early development years. So we want them to come back, to have more checkups, to let us know how things are doing. We want to be able to provide what services we can that they may need, and we just want to be sure that we're not just sort of sending them out the door with a smile and a handshake and a good luck. We want to be there for them for the long term. As children age, between the ages of 3 and 5, and they hit those wonderful those wonderful preschool years, we do some things that are very, very similar to what we did with them when they were birth to 3, and you'll see some of those same things on the list of evaluations that we do. But we also begin to get much more focused on the child's school readiness skills. So you'll notice that there's an additional speech and language and communication and sort of problem-solving measure, the self-P that's added in there, so that we can get a sense of that child's language environment, their language development, because language development is a key indicator and key support system for preschool skills. So we want to make sure that that system is where it ought to be. And if we do note that there are some weaknesses, we want to be sure that that child and that family are connected with the types of supports and interventions and professionals that can help them shore up any gaps in development and any weaknesses that may need to be supported. We also will add a behavior checklist, because we know as children hit those preschool years and even those toddler years, there's a reason we talk about the 2-year-olds the way that we do sometimes, is that sometimes some challenging behaviors can emerge. And when families are under stress and they're dealing with multiple issues that may be going on and working very, very hard to get their families on the track that they want to be on, sometimes children can develop behaviors in response to that, and that's perfectly that's normal, that's to be expected, and it's not something that we can't address. So we want to know when those behaviors begin to occur so that we can help the family intervene effectively, efficiently, and early, so that when that child hits that point where they're ready to enter school, when they're ready to go in through those kindergarten doors to big school, we want to be sure that we have given them the best possible start and provided that family with as much support as we possibly can to make sure that they're ready to be successful in that school environment and that that family is functioning and able to pursue the goals that they have for themselves. We continue to talk with the family and be in touch with the family about other behavioral health needs that other family members may have. So we continue to talk with parents about stressors and about their own behavioral health, because we know that parents sometimes ignore their own needs because they're so focused on their kids, and we always want to encourage them to secure their own oxygen mask before they attempt to help their children. So we want to be sure that everybody has access to the most supports and the best possible interventions and support systems that we can give them access to. We also are fortunate to have professionals from our social work department who can assist families in securing the kinds of support services that they may need at various points in time as they come through the clinic. As children get into those sort of big school years, we hope that families will continue to work with us to allow us the privilege of being part of their family system and help them in securing continued support and helping them stay on the path and the track that they want to be on. For kids that come to us that are 6 and above, we continue to do those screens of development. Particularly now we're interested in a lot of aspects of cognitive development, their verbal reasoning, their ability to reason abstractly, their ability to problem solve, and sort of where they are developmentally with their cognitive skills. So by this point, when they're 6, we can get a fairly stable read on that, and we like to kind of get a sense of where kids are and if there's any areas of concern that need to be addressed. We can also begin to look more closely at things like attention and what we call executive function, which is the control of attention and the ability to put cognitive resources in the direction of the task that they need to be in. So we can really begin to look for those skills and how they're developing, and if we're getting any indications of things like learning issues or attentional problems that we may need to address at this point in time, we can start to look at that a little more closely. As before, we continue to take a look at behavioral health needs of parents, of other children in the family, really of everyone involved in that family system. If there are concerns, we want to be available to that family to address the needs, to address the strengths that are present in the system and to build on those strengths to help that family do the things that they need to do. We also very much focus on what we sometimes call emotion regulation skills at this age, where we're talking about the child's ability to sort of use their thinking skills to control how they're feeling and how they're responding to those feelings. All of us who've been around kids know that there are those times where they just get overwhelmed by what's going on in their environment, and they sometimes need some help in learning how to manage those feelings and how to control the behaviors that sometimes go along with them. And what we find is that when we identify those behaviors early on, when we start to see those precursors of the child who just get so frustrated and overwhelmed that they have behaviors that kind of become disruptive, if we begin to address those when they're young and when they first begin to emerge, we can help the child and the family learn some strategies to get those behaviors under control and help the child sort of develop that belief in themselves that they can control their behavior, they can control some of those overwhelming feelings, and they can be very successful in their environment. And sometimes that involves working with a therapist, and it can involve working with the therapist, working with the school system, or working with other parts of the system. But we like to take a look at those functions at this point in time so that we can get a sense of whether there are some emerging issues that we want to get a handle on. We continue to be very, very interested and very focused on their language development because language continues to be very key, not only academically, but also in terms of their behavior. When their language is developing the way that it should, then they're much better able to kind of get a handle on what's expected of them in their environment and sort of begin to talk themselves through some of the challenges that might occur. So continuing to be focused on making sure that that language system is developing in a healthy way and helping parents know how they can assist their children in that development is very, very important. And again, as we move through these years with children and families, we want to continue to be that resource that provides them with consultation, not just during visits when they come to see us, but also a place that they can call and just find more information. We want to continue to be there to be available to that family as a resource as long as they need us. So we hope that at whatever point a family finds us and sort of allows us the privilege of entering into their system, that's the beginning of a relationship that really is of benefit to the family, that involves a partnership and teamwork that help that family and empower them to move in the direction that is best for them and their children. So we are all very pleased and privileged to be part of this clinic and to have the opportunity to work with these families. So I'm going to now pass the ball to my colleague, Pam Holland, or actually I'm going to pass it back to Crystal Welch, I believe, who will then pass it along to Pam Holland, and we'll learn more about the services and so forth that are available in our clinic.
Well, thank you, Mariana, for that presentation. I'm sure that we'll have a lot of comments and questions about how the amount of time that you have and dedication that you have toward kids, and it definitely comes through, and how passionate you are. Pam, you are also very passionate. I'm going to introduce Pam really quick. Pam is also a very proud Marshall University graduate where she received her undergraduate and her graduate work, and she's been a part of, she's an associate professor. She has been part of the Department of Communication Disorders through the College of Health Professionals at Marshall University since 2002. She is currently the Director of Clinical Education, and her passion is pediatrics, as you can tell with Mariana. I'm sure that we'll be able to hear her passion as well. She is recently board certified in swallowing and swallowing disorders, and so with that, I am now going to let Pam go ahead and start her presentation. Pam?
Thank you, Crystal, and thank you, Mariana. I think that you said it well, that you know, being honored and blessed to work with a group of colleagues like we have on the Kids Clinic is really kind of a dream come true. And so I'm proud to be here, and I'm going to move forward a little bit and talk about the Kids Clinic. The Kids Clinic is very dynamic, and one of the challenges that we had when we were developing this, and it's been a long process, is where is the Kids Clinic? And I think sometimes that's the first thing that community members might ask is, where do I go? How do I make an appointment? One of the challenges that we found through the development is getting families to come to our Kids Clinic. And so what we have been blessed with is a community that has tried to respond to the needs of our families and our children, and we have now Project Hope for Women and Children, which is that inpatient rehabilitation program where mothers are with their babies. And so Project Hope is one of the locations of the Kids Clinic and where we go to them. So as opposed to children and families having to get in a car and go to us, we go to them at Project Hope. Another great example of how our community has rallied is with RV Cares, and that is recently been opened up, I think in May. I'm going to go ahead and go through the next PowerPoint slide, but then maybe backtrack. But River Valley Cares, RV Cares, stands for the River Valley Center for Addiction Research, Education, and Support. And it is located in the old Enterprise building at the west end of town. And this daycare opened in May and is accepting babies from Project Hope as well as the community. And they have a specialized center for helping those children who have been born exposed or assisting families. And so it's a very specialized center. And so that is another location of the Kids Clinic. So we go to them, keeping families close together with their caregivers and their teachers and preventing them from having to travel. Our last place is the Marshall Speech and Hearing Center, and so some kids clinics may be scheduled at our facility, and again, some of the professionals and part of the team, Mariana's one of them, works here, so it's logistically pleasant for the two of us, but also our facilities provide great opportunities for student observers. And so, you know, Lily's Place is listed because I know that Dr. Lenz and Stacy Clem, who are part of our team, have ongoing services at Lily's Place as well. And quite often, Lily's Place, the babies that reside there often go to Project Hope and onto RV Cares. And so we are kind of a mobile clinic, if you want to say. So the Kids Clinic really goes to places to schedule appointments. But there is a central location for scheduling an appointment. And so we felt that there needed to be a number associated with the clinic so someone can call and make an appointment. And that number is the number associated with the Speech and Hearing Center at Marshall. So if you're interested in scheduling a child or you know someone who is, you can call the 304-696-3641 number. And the important thing is that you'll want to specify that you are calling to make an appointment with the Kids Clinic, or you might end up just getting a speech and language evaluation, which is not the point of the Kids Clinic. The Kids Clinic is multidisciplinary and dynamic, and so just want to keep that in mind. We are located on Marshall's campus, on Smith Hall at the corner of 3rd Avenue and Hal Greer Boulevard, and so that's where we want to call and to make the appointment, regardless of where the clinics will be housed. Kids Clinic right now is typically scheduled the second Friday of each month. We run from 9 to 12 o'clock, and families can generally plan on attending for at least 2 hours. This allows each professional to spend a little time with the family, professionals and colleagues to talk to one another, families to have conversations. And I think that Mariana said it best, in that, it's so important to include the family in the kids clinic, because often we begin our process by what the family's concerns are, and we often dictate our plan, and our process is dictated by the needs of the family, because that's so very important. And so that's why our appointments generally last a little bit longer. Again, we've already mentioned that the appointments are made over the phone. Anyone can refer. You can make your appointments by yourself. If you're a parent or a foster parent, any caregiver, teachers, physicians, anyone can call and make the appointment. Obviously, we ask that the family's aware that the referral has been made. And as I mentioned before, we want to make sure that you're specifying kids clinic when you call, because that is, really important in terms of our scheduling. Mariana also mentioned that Healthy Connections is not a one-stop shop, that you come and you get evaluated, you participate in team assessments, but we do want to encourage connections with other providers and following up. So, any baby or any toddler that's under the age of 3 generally will get an automatic referral to birth to 3. We do this because we know that these infants and toddlers are at risk for developing developmental delays, and we want to make sure that they're getting the services. And so the Healthy Connections logo, the Healthy Connections program, that's what it is all about, is just making sure that people are connected in a healthy fashion so that these children can grow and develop and be successful. So following our initial visit, we'll follow up with an appointment based on what the needs of the children are. Sometimes it's 2 months, sometimes it's 3 months, sometimes it's 6 months. And so we like to make sure that we're touching base with the families to guide them in the services that they need to get. So that's, one of our goals. Anyone can be a part of the kids clinic, and I think that's something that our founder and medical director focuses on specifically, is that while we know that our mission initially began with follow-up and staying connected with babies who are born and discharged through the NTU at Cabell, but we are open to anyone. So if you have concerns about a child and maybe hasn't had the same experiences as some of our other infants and toddlers, please feel free to refer. So anyone can come. We see children ages birth to 3 or birth to 18 years, and I think that's really important to note, is that we're open to all. And really, before I move forward a little bit, I think that might be all for me. Just wanted to reiterate a couple things that are important from what Mariana had indicated. But quite often the babies that we see start off in this world with some difficulty with feeding, and that's one of the areas of speech-language pathology. They have disorganized suck, swallow, breathe patterns. They have a poor ability to maintain the suck for the entire feeding, and often these infants have gastrointestinal issues that make feeding very unpleasant. And if this is not evaluated early on and provided appropriate treatment, those feeding concerns and feeding disorders can continue as the child develops. We know that children sometimes come to us with social attachment difficulties, with decreased vocabulary, decreased attention, and increased impulsivity, and all of those interfere with language development. I also will reiterate what Mariana said, and that emotional regulation is so important for entering school and being successful. And we know that individuals who have language impairment are more susceptible to having emotional dysregulation. So having a speech therapist on your team to help with those communication deficits is essential. And then before I turn it back over to Crystal for opening with questions to us all, I would encourage each of you, if you're a provider and you're working either within Birth to Three or in the schools, to develop your own team of professionals, because this is not something that can be tackled, or we really can't find the resources for our families if we're doing this in silos. And so I would encourage you all to come together and find the passionate people that you work with that really want to see children and families be successful, and form together and do your assessments not as one individual but as a team, because I can't say enough positive things about the team on our clinic. Okay, I think I'm going to toss the ball back to you, Crystal, and then we'll go from here to questions.
Sounds great. Well, thank you, Mariana and Pam, and for those listening by recording, and Dr. Payne, we just really appreciate her being able to record a message for us, too. So now we've come to the question and answer portion of today's webinar. For those of you that would like to use the chat and Q&A function on your WebEx player, we will address as many of these questions as time will allow, and if not, we can always post the questions and answers on our Healthy Connections website. But they are certainly rolling in. We have several questions, several people wanting to know about location. One says, I love the collaboration I hear you talk about. I would like to know if the kids clinic is for Cabell County only. Another question says, are you serving Huntington area children or all over the state and even out of state in Lawrence County, Ohio? So Pam, do you want to tackle that one?
Sure. I was just getting ready to respond to that chat. Right now we are just in Huntington, and but that doesn't mean that we wouldn't welcome individuals outside of the Huntington area and other states to come to our clinic. So, this is a West Virginia program. Right now, there's not a charge for our services, so we're going to be at the clinic whether no one is there or not. So, I would encourage you to send your children our way, and ideally, we would love to have this clinic mimicked in other counties across the state. And so, but right now, we've got Mariana, myself, and those in social work, and Stacy Clem, our physical therapist. And, we're all busy doing other things. And so the idea of traveling across the state would make me very thrilled, but I don't think that we can manage it just yet. So, Mariana, is there anything else you'd like to add to that?
No, I think you covered it. Yeah, we're happy to see anybody from anywhere. It's just our locations are all in the Huntington area.
Great. Our next question also asks approximately how many children and families are currently enrolled in the program. I know that at this point you've mentioned Project Hope, but if one of you all want to expand on that question.
I don't have a number, and I know that Project Hope was opened in January, and we started there. So every family that's entered Project Hope, we've evaluated and provided resources and referrals to those families. I'm going to throw a number off the top of my head, Mariana, and it's probably going to be around 15. So it seems low, but this is one of the reasons that we're trying to do webinars, is to get the word out, because we know there's more children that need this service. Mariana, would you agree with that number?
Yes, that number is about right. And again, as you say, because we're getting started, but we hope that number will grow substantially.
Well, our next question is probably an important question. I know that it was on the slide with Dr. Mitzi Payne. The next question says, what is the cost of the kids clinic?
Right now there isn't a cost. So I'll leave it at that.
All right. So I know that sometimes we wanted to advertise it as a free, and sometimes that has sometimes a negative connotation. So we like to keep it to say no cost at this time. So no cost kids clinic. You can't beat that, as Pam said at this time. The next question asks, how can I get some of the brochures that you flashed up on the presentation? So I guess I'm going to go ahead and tackle that question. If you want to let us know, okay, I see your name. If I can get with you after the webinar, and we can see where you work, or if you want to swing by, we have a supply of brochures located at RV Cares through the Family Navigators. They are often out and about, and so it would probably be the best to probably call them at 304-429-3882. But I can give you that number as well. These are the brochures at this point, or the rack cards as we call them. They are cardstock. We are actually have a distribution. We had a call about that this morning before our webinar on where we're going to be distributing these cards, the rack cards, in psychology and psychiatric offices and pediatric offices as well. They have been distributed, but in the WIC offices as well in the community. So we have three. If I can maybe move our, there we go. Oops, one more. Here's the brochure. If you'll notice on the right side, it has a red by appointment only. We have three of the cards. One has a red strip, one has a blue strip, and one has a purple strip. The purple strip is distributed to the WIC offices, and the blue is for providers, and the red is for community. That way, when the parents bring them back, or when they call the number, we can say, hey, how did you hear about it? And is it red, blue, or purple? That way we can kind of know where we are getting our biggest response. I do know that Pam and Mariano, you can correct me, I think that we did get a response from our WIC office because the brochure came back purple. So we are receiving those back, and it's really a great way for us to be able to track that. So I hope that will answer that question. Our next question asks, let's see, will the kids clinic offer parenting classes? I'll go ahead and try to answer that, and maybe Pam and Mariana, maybe you can chime in. You know, although we exchange a lot of tips and tricks between moms, and we give support to moms, the appointments are private, and they wouldn't qualify for a parenting class. However, you know, that might be something because of the location. There might be some information that we could navigate parents to parenting classes if need be. We have a comment. Okay, go ahead, Mariana.
Oh, I was going to say.
Go ahead.
Oh, no, go ahead.
No, go ahead, Mariana.
Go ahead, I was going to say we hope to add parenting classes. I know from the Department of Social Work and Psychology and Communications, we hope to add them at some point. But I'll turn that over to you, Pam.
Nope, you stole my words. I was just going to say that our graduate students in the prospective programs are working on some of those parenting programs. We've done some with the mothers at Project Hope, and I think they have one scheduled this summer in July for those families interested or receiving services at RV Cares, but that one is also open to the public. And so I will be sharing that group, that mom's group or parent group, on our Facebook page, and I'll send it to you, Crystal, too, so that you can share it as well on the Healthy Connections webpage. So, I think it's mid-July.
Perfect. And we have a comment. The comment just says, we'd love to have a clinic in Southern West Virginia and would be very interested in helping getting things like this implemented. So that's very encouraging to hear, because I think that's the best compliment that you can give to these folks is being able to replicate something that they're doing, and just really sustaining the momentum of what they're doing. Another chat comment says, thank you very much for this informative session. I'm encouraged to know we have such a proactive clinic for infants and children, and it's refreshing to know that this rockstar team is working with children who have been either drug exposed, or that parents with general concerns can come to Kids Clinic. So that's a great comment. Thank you for sharing that. Let's see, we have another question. Could you share your website again, and do you have social media presence? What a great question. So if you look at the bottom of your slide, you will see the healthyconnectionswb.org logo. We realized from the beginning that that's not necessarily a low literacy word, and it's also something that can be sometimes hard to type and long. So we have a truncated website address as well, and hcwv.org. So that is, and once you go there, you can also look at our Facebook page. We are on Facebook. We have the social media presence is definitely there, and that is one of the shameless plugs I have in a slide here in just a few minutes. So I appreciate that question. And this is another question that came in. Are you accepting donations, and if so, what do you need? Where can we bring them? Pam or Mariana, I know that we have, for our kids clinic, we've asked for chunky books and maybe Lego box or diapers. I'll let you all answer that. Tell us what would be useful for people who are willing to give donations.
The answer would be yes, 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 and yes. We are indeed. So one of the things on our rack card you'll find is that parents are provided what we like to call a goodie bag every time that they come to Kids Clinic. So the children get a little something, and even if it's a pack of diapers or a pacifier or a blanket or a pair of pajamas or a book, we try to give something that will help both the child and the family. And so I don't know that we have an organized place to keep those things, but certainly we would house them at the Speech and Hearing Center at Marshall. I know that RV Cares would be glad to host those as well there. I'm going to do a shameless plug here, too. We have many graduate students here on campus that would come to you to pick up some things, so if it's not too far. So, books, diapers, blankets, pajamas, puzzles, anything educational, even books for parents. A long-term goal would be to have a library of resources for families, foster families, grandparents, those types of things. So we welcome anything and everything. And of course, monetarily, if you send money, we'll make sure that goes straight to the kids.
Awesome. Thank you. We have a comment, if people willing to assist with Kids Clinic, in particular Mountain State Healthy Families, mentioned that they would be happy to partner since they are a home visiting program and service with child development and parenting information at no cost. So there's partnering opportunities. This question just says, how can we partner with you?
I would say maybe get in touch with Pam. I was going to throw it to you and say probably get in touch with Pam. Would that be the best thing, Pam?
Absolutely. You can send me an email. Let me know what ideas that you have. and we will collaborate, indeed. And my email's, I think, on the side, but it's just holland@marshall.edu.
Wonderful. And we have one other question. Are all the people that were listed in Dr. Payne's slides present during the kids' clinic, or do you take turns rotating staff at appointments?
We all try to be there, and ideally the best clinics run when every single professional is there, but we know how life gets in the way sometimes, and so, you know, Dr. Payne's in Europe. Who are we to say that she shouldn't be going over there and spreading the good work and the research that she's doing? And so, you know, our last kids clinic, Dr. Payne was not there. There was a child that we felt she needed to be seeing, and so we made that referral. And so for the most part, our team is present. We've committed to that day, but sometimes life gets in the way. And if we find that there's a child that needs a service that is not present, then we make sure that referral is made during the kids' clinic.
Wonderful. And we have a chat that gave us a nice plug here for a way to get books for free. So thank you, Cindy, for sending us that. We will not forget that hint that you just sent us. So thank you so much. We are at the top of the hour. We can also accept a few more questions, but let me go ahead and give you some other, just a presentation recap while some other questions might be coming in. So with kids, knowledge and developmental steps, we learned about that. We learned how we bring together both medical and behavioral specialists and to serve the families and children, particularly those affected by substance use disorder. It is no cost. It's one-stop monthly clinic, and we often give ongoing screenings. We want to follow children, not just one kids clinic, but to keep them coming. Dr. Payne mentioned up to the age of 18, so that there's no limit as far as age, and we just provide those physical assessment, behavioral development, children with NAS or neonatal absence exposure, but then open also to anyone with a concern or any other children. So how can you help? This is where our plugs come in for Healthy Connections. Join us. Feel free to join us at River Valley Child Development Services. That's their office on 7th Avenue, the second Thursday of every month at 11 o'clock. Reduce stigma by using negative speech. That's something that we're really going to be hitting hard with a campaign starting in September for Healthy Connections, and using substance use disorder versus substance abuse is just one of those words. And if you want more information about how words do matter, you can visit us at healthyconnectionswb.org and look at our the literature that we have posted there. Display our RAC cards. I do see where in the chat we had some people that have requested RAC cards even in other counties, so we will get with you. And finally, like us on Facebook. So check us out, and we would love for you to be able to keep in touch. Send us your news. If you want something, if you have something to share, please feel free to do to share it with us, and we will post anything and everything that you vetted within reason, I suppose. Can't make all those promises. So to wrap up, when you signed up, you had a pre-event questionnaire. That we have a post-event feedback that you will be redirected right after the session wraps up, and I just wanted to let you know what's coming up. We have River Valley River Valley Center for Addiction Research, Education, and Support, RV Cares. That's who will be our next partner spotlight. So stay tuned, and thank you for signing up for this webinar, and keep the series going. Be sure to be on the lookout for that. We'll be learning how the high-risk kids are being seen. Recently opened just last month, and so we're excited about them to be a partner spotlight for our next webinar. I'm going to just check one more time, we have a couple of questions that we won't be able to get to today, being at the top of the hour. So with that, I just want to thank everyone for joining us today, and we just really appreciate you taking the time to learn more about the Kids Clinic, helping families affected by substance use disorder. And we realize there are busy schedules, and we hope that you found the content discussed today very helpful, and we look forward for you to join us with future webinars for Healthy Connections. Again, where we'll spotlight more community partners. If you're interested in being spotlighted, please contact us. And as we continue to work with all points of connection for the Huntington area. So this concludes our webinar. Have a pleasant day, and don't forget to complete the feedback form. Goodbye.